Hi, my name is Dr. Craig Tiburzi from Tiburzi Chiropractic and Wellness Center. I'm joined today by Kristi Warren. She is the owner of Brains in Motion out of the Springfield area. And we are here because we want to inform and teach about the sensory issues and the ADHD issues that are just being bombarded by kids these days. And I feel there's a huge misconception about where these problems are originating, what's causing these problems, and we just like to kind of clear the air and let some parents know that there are solutions and there are alternatives other than putting your children on mind-altering, neurologic changing chemicals and pharmaceuticals. I'm 41 years old. I grew up in the 80s. And basically, when you were in school in the 80s, you had two rules. Don't call kids names and don't do drugs. Everybody remembers the DARE officer showing up. And now it's crazy. Every kid almost seems like they has to have a label, whether they're ADHD, whether they are autistic, sensory, anxiety. And they've all got their medicine to go with them, whether that be ADHD medication, anxiety medication, and
depression now too is getting huge.
It's huge,
kids.
Absolutely, and it's just, to me, it's a scary world because I fear that in a period of time there is not going to be enough healthy kids to take care of the sick ones. I mean, we don't know where this is going, but it's changing at an alarming rate. I mean, I am a chiropractor. But I'm not your typical chiropractor. We see half our practice at least is kids, and those kids don't typically have back problems. They have nervous systems that need attention, and there's so many parents nowadays that want something different, that they realize the system that their children are in just isn't working. And that's what gets us up every day. That's why we do the things we do here, because we fear for the next generation, and that's why we see so many kids and we work on health restoration. I'm going to let Kristi tell you a little bit about her practice as well.
Okay. I'm Kristi Warren, the occupational therapist and owner of Brains in Motion, and I am not your typical occupational therapist either. Use a lot of holistic and outside the box kinds of things to help these kids overcome these neurological deficits. By the time kids come to me, they usually have tried medicines, your traditional medical approach, and just aren't getting any better. Most of the time, they're getting worse. And I have been able to get my own son off of medications, and several of our clients have either decreased their medications or gotten off, and their quality of life is so much better, and they're thriving where they were struggling so much before.
So as we're talking about the ever-changing child nowadays, I'm pulling stats from 2015, so they're probably worse now. But right now, we have a chronic pandemic of illness in children in this country. 1 in 7 kids are ADHD. 1 in 45 are autistic. 1 in 10 has asthma. There's tons of sensory issues out there. And 1 in 5, you don't even think about this, but 1 in 5 has been diagnosed with some form of mental illness. That's crazy. 1 in 5 kids with a mental illness is sad and scary at the same time. In this country, every 8 minutes a kid gets rushed to the emergency room because of an adverse reaction to prescription drugs. And that adverse reaction is ones that were properly prescribed and properly taken. And that's just not right. That's not how it should be. And families are not experiencing the quality of life that they had just some years back. And I hear parents be like, well, where's all this coming from? And a lot of times you hear, well, it's genetics. Well, that's crazy, because genes change over hundreds of years, not from the 80s to right now. Genes change over a long period of time, not in just a short period of time like we've seen now. And my thought is, where's it going to be 30 years from now? And 30 years may seem like a long time, but it's not. And I've got a little video that I want you to watch right now. It's called an awareness test. It's kind of funny, but we're going to talk a little bit more about it when you finish it.
This is an awareness test. How many passes does the team in white make?
Go!
The answer is 13. But did you see the moonwalking bear?
All right, now that you've finished that video, I'm guessing most of you probably didn't see the moonwalking bear, as I did not the first time I watched it, but the moonwalking bear is really the component that we're missing in taking care of these kids. I talk, and Kristi as well, we talk to parents every week that are struggling. Whether they're struggling with their sensory autistic child, whether they're struggling with just chronic sickness and immune challenges, the story is always the same. Is when you talk to them, is they typically had a stressful pregnancy. They didn't have the easiest birth, and they had a child that just wasn't easy. A lot of times colicky, reflux, constipation, didn't sleep. The list goes on, but most of these moms have the same story. And in our office, and Kristi as well, we've kind of used the terminology, when you have a neurologically damaged child that's struggling, what it took to get them to that point was a perfect storm. And what we mean by a perfect storm was everything had to happen. Not just one event caused it, but there were lots of things that led to your child being in the position where you're not happy and getting the results and health that you need right now. And that moonwalking bear that you just saw in that video is kind of what we're going to talk on. We're talking that moonwalking bear, that component that's missed. When you have a child that is struggling, that's on the spectrum, that has, even if it's just something as simple as texture issues and sensory issues, 3 components led to you getting to that point. It is toxins, it's traumas, and it's thoughts. And everybody with a struggling kid understands the toxins. More than likely, they've already worked to some extent to change the diet. They have put them on some form of supplements. They've studied vaccine ingredients. They know there's stuff out there that could be influencing them, and they've tried that, and they're not getting the results they want. The 2 major miscomponents, we're going to talk a little bit about thoughts. Kristi's a mom of 3. I've got 2 kids. Moms are stressed the entire time they're pregnant. Don't you agree?
Yes. And there's so many, especially with all of these increased numbers. You're constantly worried as a woman that's pregnant that what could go wrong? What could happen? What if they have autism? What if they have ADHD? What if they have Down syndrome? You have constant stress, and then you have your everyday environmental stress, and a lot of us are working now, which back in the day, they didn't happen. So there's so much stress on the woman's body, and I don't think we are putting enough credit into how that's affecting that developing fetus and their neurological system.
And we're going to talk here in a little bit about the most important nerve in the body that's called the vagus nerve. But the vagus nerve is what hardwires mom's nervous system to baby's nervous system. So when mom's in stress, baby's in stress. And, we've talked about this a little bit earlier, but from the first time a woman goes to the doctor when she finds out she's pregnant, it's a list of everything that can go wrong. And it starts that fight or flight fear mentality from the beginning, and that is being passed on to our kids. So we already have talked about the toxicity component, and we've talked about the stress, but the biggest component in all this is trauma. And you may not think about trauma, but the trauma of the birth process itself. When mom's stressed out during pregnancy, there's a lot of intrauterine constraint where baby just doesn't have the space to move like it would if mom was relaxed and things like that. And the delivery process nowadays is very traumatic. Women were never designed to lay pretty much flat on their back to have a baby. The medical intervention in the process of baby being pulled out because mom is laying down, 60% of births nowadays have some form of intervention, and on a minimal level, that's just, pulling the baby out. But 40% of births nowadays are C-section. The World Health Organization says that less than 5% of births should be C-section. And in the United States, we're going to be in a couple years be at 50%. Now, are C-sections necessary? Absolutely. If mom's in trouble, if baby's in trouble, they are necessary and do great at that. But they should never be coming up on 50%. When a child is born via C-section, and you can look online and find C-section videos, but there is 60 to 90 pounds of axial torque put on the skull to pull that baby out. That is damage from the birth process right from the beginning. Although it needs to happen sometimes, when it does happen, there needs to be steps put in place to work on fixing the damage that's done after that.
In my practice, what we focus on are called primitive reflexes. Those are the early reflexes that infants are born with. And when you talk about these traumas that are going on, those reflexes are not allowed to do the job that they were designed to do. So if you get a C-section, there's a reflex called the spinal galant, which is what helps the baby come down the birthing canal. And if that doesn't happen, if it didn't do what it was intended to do, that reflex stays on. Well, guess what happens? That is stimulated the spine, and it causes you to laterally flex side to side, and that's how it wiggles down. Well, if that reflex didn't get to do its job, it did not turn off like it was supposed to. So now the back of a shirt, the back of a chair can stimulate that reflex, and now you've got a kid that's wiggling and can't sit still, and they're diagnosed with ADHD. Not always the case that that's what they have, but all these reflexes are symptoms of these labels that we're giving, and that's why the treatments are not giving them the results, because it's not the true cause of what's causing the problem. It's these early traumas and these reflexes not getting to do the initial job that they were intended to do because we've intervened medically through inductions and C-sections and the traumatic part of birthing process.
Yeah, I mean, and when I'll talk to parents sometimes, and I will ask them if they had a normal, what was the birth process like? Was it normal? And most every parent thinks they had a normal birth process because the kid came out with 10 fingers and 10 toes. And they don't even realize that C-section is not normal. They don't realize that induction was never supposed to happen, because a baby's supposed to come down the birth canal gradually. And when we induce, a baby comes down the birth canal very quickly, and they don't get a chance to have you get something, your reticular activating system happens as you come down this birth canal. And it's supposed to happen in slow periods. And these kids that are being induced, most of the time, don't get that to happen. It's just another part of that birth trauma that's leading to so many problems later on.
And that Moro reflex, going back into the reflexes, Moro is our fight or flight reflex. That is what is supposed to put a woman into labor. It initiates labor. So if we induce, then again, that Moro reflex didn't get to do its job. So why are we seeing so many kids in this fight or flight state constantly? Because that Moro is activated and never got to integrate the way it was supposed to.
So as we talked about, the 3 T's, the traumas, the toxins, the thoughts, and the trauma being the main and mainly the birth process. But then once we get this child into the world, nowadays the Back to Sleep program, which had great intentions, puts a kid spending way too much time on their back, which can create a lot of times a flat spot in the skull, which is called plagiocephaly, which when the skull starts to flatten out and you think about the anatomy of it, the brainstem sits right there where you get a flattening skull. Kids nowadays spend way more time, because of busy lifestyles, in car seats, leads to part of the trauma after the birth process. The bumbo seats, which in my opinion should just be thrown away, because they're forcing kids to be in a seated, upright position before they're strong enough to support their spine. But the 3 T's lead to what we talk about in this office a lot as the 4 D's. Actually, it's really 5 D's. You have what's called dyskinesia, disafferentation, dysautonomia, dysponesis, and disconnected. And those sound like big scientific, nerdy words, but it's going to make a lot of sense in what's really going on with the anatomy and the neurology of this child, and why we're very good at helping these kids. So let's start out and let's talk about dyskinesia. Kinesia is the study of motion. And if you know anything about these children, what do they want to do, Kristi?
They want to touch everything. They got to be moving constantly.
They want to move. Movement is great for the body. You need motion, but dyskinesia means lack of motion, lack of movement. And specifically, what Kristi and I talk about the most in this is the upper cervical spine. That's where most of the time these children are damaged in the birth process. And in that upper cervical spine is your brainstem. Inside your brainstem is your cranial nerves, which is sight, taste, touch, hearing, and smell. Most people know the 5 cranial nerves, but they don't know the other 2 is movement, coordination, balance, also lives in that brainstem. And when things quit moving, the next thing that starts to happen is a process called disafferentation. Well, the afferent system is nerves that are going from your body back up to your brain. It's giving your body the sensory impulses that it needs. It's giving your body its biofeedback. When you lose motion of a segment of the spine, you're not getting feedback from wherever that spinal area is going to. The spine itself is a living, breathing organism, but chiropractic has done an awful job over the years of even explaining what they do. They talk about back pain and the spine, but the spine is the motor to the brain. Movement of the spine is how the brain senses its environment and what's around there. I mean, you think about if you're on a plane for 10 hours and you're in a coach seat, you're not very happy. You just want to move. You need that motion. But when an area of the spine gets damaged and you no longer get that motion, the spine needs that. It's craving that motion. And these kids that are damaged and have a fixation in the spine, in chiropractic we call it misalignment or loss of motion in the spine. We call it subluxation. But the major component for these kids is the fixation, that it quits moving and they're no longer getting sensory input through that area. And when the spine is not doing its job, the 60% of that sensory input comes from the spine. The other 40 comes from the mouth, the hands, the feet, the genitalia. So when a kid is not getting this motion from the spine, what do they start doing? They have to touch everything because they have to stimulate and calm that brain. So we've got the dyskinesia that starts, which is the loss of motion, typically in the upper cervical spine, leading into disafferentation. Afferentation is the input that's going from the body to the brain. There's only 2 types of input that can come through that system. You can have proprioception or you can have nociception. Proprioception is the good input. It's what your brain craves. It's motion-based. It allows the brain to hear from the body what's going on in that area and that it likes it. The opposite of that is when segments refuse to move, when they're fixated, you get nociception from that region. So anywhere that you don't get motion, you get nociception, which is bad noise that the brain doesn't like and typically makes for an anxious, hypermobile kid. So we go from dyskinesia to disafferentation. The third step of the process when we're getting bad energy in is dysautonomia. Autonomia is how your autonomic nervous system works. Your nervous system consists of the brain, the spinal cord, and every organ, cell, and tissue that connects to that. Your autonomic nervous system is everything that your body does automatically. It's what runs and governs your body, from your organ systems to your immune system to your digestive system. That is all automatic. You can't make your heart beat. You can't make your liver detoxify, but it has to get a signal through the autonomic nervous system. When the autonomic nervous system is irritated, when it's not getting proper feedback, it goes into what's called sympathetic dominance. Your body has, through the autonomic nervous system, your body has 2 modes of operation. It has, with kids, I a lot of times call them gas pedal and brake pedal. You've got the sympathetic nervous system and the parasympathetic nervous system. Your sympathetic nervous system is where the body goes when it's stressed, when it's in fight or flight mode, when something's not right, when you're in chronic stress mode. That is a body that is agitated. It's usually rigid. Most of these kids that we deal with in the beginning, lots of times are pretty undersized, wouldn't you agree? Mm-hmm. They're wound tighter than a cheap watch. They're very rigid, and they are in sympathetic dominance. Mm-hmm. The opposite of that is your parasympathetic nervous system, that is controlled by your vagus nerve. We talked about the vagus a little earlier. The vagus nerve is the most important nerve in the body, and it's definitely the most important in dealing with a stressed out, sick kid. When you're in your parasympathetics is where your body goes for rest, regeneration, healing, growth, development. It also runs your immune system, and it runs your digestive system. So where do you think these kids should live? They need to live on the parasympathetics. I call in this office, that's the brake pedal of the body. That is your vagus nerve. The vagus nerve hardwires from your brainstem all the way to your stomach. And in the process of that, in the neck, the vagus nerve actually sits less than 1 millimeter from your first vertebrae. It almost lays on it. It goes down, it drops into your chest cavity. It controls the right side of your heart, which is your body and your heart's ability to calm itself. It pierces your diaphragm, is responsible for most of your breathing. It helps to open your esophagus to help process food. It ends at your stomach, stimulates digestion, spurs the immune system. So when the autonomic nervous system is off, the body is in sympathetic dominance, which is this stressed out kid that no parent wants and no teacher wants, because a lot of these parents, the kid's 7 years old and still maybe sleeps 3 hours a night. Not many people can function off of that. So the dyskinesia leads to disafferentation, to dysautonomia, which leads to dysphonesis. Phonesis is energy expenditure. So if the first three aren't right, how do you think the energy is going to be? The energy levels are going to be high. It's going to have abnormal output of energy. And that's when mom and dad start getting called from teachers that little Johnny can't sit still, and let's put him on a mind-altering drug so that he's quiet. Well, you can chemically alter a kid to make them sit for a while, but that's not their state. That's not their state, and it's not their fault. Their body is producing extra energy because of these components of the dyskinesia. So Kristi and I kind of found each other through a patient of mine, and I think that's important for people to understand, is that a lot of times kids don't necessarily get everything they need because professionals can't work together. Whether it be chiropractors, physical therapists, occupational therapists, your MD, everybody wants it to be their ball game, them handle it, rather than pairing up with other professionals for the betterment of the child, as opposed to trying to do everything themselves. I have had awesome results treating these sensory and autistic and spectrum kids in this office, but I also knew that there was other professions having great success, and I felt it was important to reach out and find somebody that had the same mindset but was coming at it from a different approach, and that's kind of why Kristi and I have paired so well together. But Kristi, she worked in the public school system for, 7 years. Mm-hmm. And give us kind of a rundown of why you left that sector.
Okay. So as an occupational therapist in the school setting, I am very limited on who I can help. The children have to be diagnosed or have an IEP, and occupational therapy is a related service in the school system. So you have to have a cognitive impairment, or you have to have the label of autism, or you have to have a learning disability for occupational therapy to get involved. Well, a lot of these kids aren't even diagnosed with these things until 2nd or 3rd grade or even higher. So I knew that there were teachers that were coming to me and asking for help, and I can give only so many suggestions for them, but I couldn't get my hands on that kid and help them and do the things that I knew that child needed because of the parameters of the school setting. So I was having such good results, And my son, as I mentioned earlier, was kind of our guinea pig, and he got off his medication. And I felt so tied down in the school system and couldn't get to all of the kids that needed my help and all of the families. So I had to take this out to the community, and been running across you, and we have similar belief systems, and it takes a village to help these kids, and I'm a strong believer in this is my piece of things, and I know that others need that piece so that we can get that whole child to be the best that they can be.
When I think of combining with an occupational therapist, specifically a pediatric occupational therapist for the most part, chiropractic is working these kids' neurologic pathways from the inside out. We're removing the subluxation, removing the nervous system interference to start creating new pathways for these kids from the inside out. Whereas I visualize, and I'm a visual learner, I visualize then Kristi taking these kids and working from the outside in, and we're meeting in the middle to form new neurologic pathways for these children. I stated earlier when we talked about that, nowadays every kid has to have a label, whether it's sensory processing, autism, anxiety, they all have a diagnosis. And that's just not how we do stuff. I have 3 terms how I group these kids. That's kind of my own goofy way, but it's how I come up with a care plan, how we're going to treat these kids. And it's 3 goofy. One group is called raging bulls. That is your typical, your ADHD kid. Just that energy is off the charts. They don't sit still well. They very impulsive. Typically, the energy that moms and teachers want to duct tape them to their seat. And then we have what we call a drunken bull. A drunken bull is a kid that typically has low core tone, usually very forward head carriage. A lot of times we'll have speech problems, fine motor control, loss of coordination or lack of coordination is your drunken bull. And then the 2 mirrored, if they have both of that, I call it a drunken raging bull in this office. And that is typically your autism diagnosis. A lot of times these kids also come with like seizure disorders, things like that. And, Kristi and I talk about this. It's just my terminology, but we can relate that back and know how to classify these kids and what they need. And Kristi and I both will evaluate your child, and we'll do it very differently. I use some equipment called the Insight, which is nervous system scanning equipment, where we are measuring the energy going through their proprioceptive system to their brain. And Kristi has an evaluation process that is a more hands-on approach. If you want to give them a little bit of that.
Yeah, so the main thing that I've talked a lot about in this video is those primitive reflexes. So I always evaluate not every primitive reflex, because that's not necessary, but some of the big primitive reflexes, the characteristics of those reflexes are tied to a lot of these labels that these kids are getting. Because if that is on, that's our foundation. That's our foundation for our behavior, for our learning, for our coordination. So we have to treat that first and then keep moving our way out. So my evaluation is fairly quick. It takes about 20 to 30 minutes with the child, and then I spend another 30 to 40 minutes with the parents, and I like to have the child involved if they can be, to explain why these things are happening and what the reflexes are that are there and how that relates to the problems that they've been addressing and the reason that they're coming to our office.
So as I brought up, we scan the nervous system in this practice to figure out what classification your child falls into. And as you can see on these scans, the first thing we're going to look at is the numbers on the bottom. Your total energy, if you're looking at this picture, it's 537. That number should be 100. 100's the right amount of energy in the body. This kid's got more than 5 times that amount. If the only number that was high is the total energy index, that would be your raging bull child. If the energy level is more normal, but this pattern score is very low, That would be your drunken bull child. And then when you have a child that has a very high total energy and a very low pattern and a very low symmetry, that is typically the kids that fall into that autism spectrum disorder, things like that. This is a case study I want to show you here. And this first scan was taken on the 25th of May. This was a mom that brought me a little boy. He had already been held back and didn't start kindergarten when he was supposed to. And he had already had this is the summer before he's going to go to kindergarten as a 6-year-old. And he had already had his IEP meeting and he was put on the spectrum, and she was very nervous about him going into school. And so first of all, we examined, he was a rough pregnancy, a very stressed out mom, an emergency C-section. He was super colicky, didn't hardly go to the bathroom, and he had been on over 30 rounds of antibiotics for chronic ear infections. And he had horrible skin issues, horrible digestion. So first of all, just putting my hands on him, I found severe fixation and upper cervical subluxation at both the brainstem, which is your occipital level, and C1. So if those areas are affected, you know the vagus nerve is affected, which means the brake pedal's not working, so he's in sympathetic dominance. So on the first day when we scanned him, he had an energy of 537 and a pattern score of 55. So right there, you think autism right off the bat. And mom was all on board. Let's try something different, because they had zero success. And so this is another reading here. The second scan I'm going to show you is just another view of how we look at it. Just to give you a point of reference, white means that the nerve energy is normal. Green means it's mildly irritated. Blue, moderate. Red means it's got tons of energy, just off the charts. And you can see he is just lit up on this scan. So after we started working for about a month, and he'd had about 15 treatments at this point, this is his second scan, and his energy was down to 195 and his pattern was up to 69. That's a huge change. Mom reported instantly we were sleeping better. There was less fits, just a more calm, connected kid. And this is here a picture of his second EMG. There's still lots going on in the neck area, but the rest of the body is really calming down. Now these were taken way back in 17. He is still a patient in this office, and he no longer has an IEP. He's now in 2nd grade, and mom reports he's a straight A student. He is not a problem in the class. He still, from all the toxicity early in life, one of those 3 components, still battles tons of skin issues. When his diet gets off kilter, his skin acts up, and we have a kid that is hard to calm during that time. But for the most part, been a excellent student, calm in class, not a problem. And that's just the joy of this part of the job, is that this mom now she feels like, for the most part, she has her kid back, what she signed up for in being a parent. And so between these scans and Kristi's evaluation, we can accurately put your child in the category they need and give them the care, because no 2 kids need the same program. Some kids need chiropractic, OT, behavior modification, they need diet, they need movement therapy. Some kids may only need chiropractic, some kids may only need occupational therapy, but we don't know what your child needs till they've been evaluated. I think when you're considering doing something outside the box for your kid, you need to ask yourself, how is this affecting our life? And if the answer is that you're not getting the quality of life that you thought you were going to have when you wanted to become a parent, then it's time to do something different. Give us a call and let us sit down, take a clinical history all the way back through the pregnancy and the birth process, and we'll put the pieces together and explain to you in depth why your child is struggling in the ways that they are struggling, and come up with a plan of attack. And the question, we get asked lots of questions, and I know one of the big things for me is, well, Are they too old? Like, what's the point where they won't heal? Well, before the age of 5 is best, and the second best time of that is today. I mean, I've seen ADHD 17-year-olds have great results because your body has neuroplasticity. It always wants to heal. But the longer the problem has been there, the longer it takes for the body to heal. And a lot of people want to know how long. And
it's very individualized.
Yeah, everybody's different. And, most people, they think chiropractic, they think back pain, and they come in, and I'm going to use the air quotes, they get popped a couple times and their back's fine. Well, chiropractic was never about the back at all. It was about the nervous system. And these kids that have neurologic issues, they take a lot of care. And the chiropractic aspect of it, you have to repetitively retrain that nervous system to get the results that you want. And Kristi, sometimes, her and I were just talking before we shot this, that you have kids that sometimes they're so neurologically challenged with what you do, they can't even handle that much care. So it's different for every child, but you need to know the answers. You need to know what's going to help your family, what's going to help your child, and what's not. We are in this office, we use very gentle, delicate chiropractic techniques on these kids to stimulate the nervous system and retrain the pathways. Now, Kristi is, for a pediatric OT, she's very outside the box. She uses laser therapy on these reflexes and everything. I'm going to let her explain that a little bit to you in depth.
I just want you guys to know that there are options out there, and a lot of people don't know of these alternative, and a lot of the kids that I have seen have gone to traditional occupational therapy, and yes, they've had some improvements, but when you're looking at it from this outside the box and this holistic approach, you're taking it to that next level. So we use a cold light laser therapy, which helps to integrate these reflexes at a cellular level. So it's getting deeper than what I can get with my movements that I do. We do even have movements to support it. But then we also, once we get those reflexes integrated, the other piece that our practice really focuses on is some of the emotional components and how those emotions can block the energy flow of the body and cause these kids a lot of difficulties. I think Craig and I both hear frequently, oh my gosh, I feel like I have a typical 2-year-old now, or I feel like what I'm experiencing now is a typical teenager attitude as opposed to the teenage attitude on top of all of the difficulties that we had before that. And that's all we're wanting to bring to you, is to have that typical child that you longed for.
And another thing that I've noticed, some parents they even have anxiety and anxiousness over the thought of bringing their child into either one of us, because a lot of times life in general doesn't go well because of the tantrums and the outbursts and the fit throwing. And if you're nervous about coming in and the consultation and things like that, something we've started doing is doing phone consultations. So we get the majority of the information out of the way over the phone, that you don't have to be anxious about bringing your child in. Then by the time you bring the child in, it's just to scan them, to examine them, to do that. And then we can sit back down without the child again and come up with a plan of attack. We're here to make it easier on you to get your kid help, not to make it more stressful.
And I'll tell you, I've been hit, hair pulled, bit. I'm not afraid of it. I'm used to it. And what's the best feeling in the world is you have a kid that you evaluate like that. And then when they're ready to leave my doors, they are hugging you and laughing and talking and smiling. And that's what makes this all worthwhile. Is because we can make those changes.
Yeah, I mean, I'll have kids in the beginning that I can't hardly put my hand on them, let alone do anything else. And now they're the kid that's hanging on your leg, wanting to wrestle with you. And if you know anything about a lot of these kids, that's big steps for them. And if they can handle the energy of this office at 5 o'clock at night, that tells me they've come a long way. So if you've got questions, if you've got concerns, give us a call. We'll go through this step by step with you, explain to you what we're going to do and what can be done to give your family their quality of life back. I hope you found this informative. It's a ton of information. I have tons of resources if you'd like to learn more, but give us a call and we will get a plan figured out for your child.